Hey everyone, welcome back for another deep dive. Today we're taking a close look at green endocrinology.
Green endocrinology.
Yeah, I feel like everyone's talking about it, but not everyone really knows what it is.
Right.
And as endocrinologists, I think it's something we all need to be up to speed on.
Absolutely.
So today we're going to be talking about, what it really means. And we're really lucky to have a leading expert with us today who can really break down why it matters, especially for endocrinologists like us.
Wait, to be here.
So let's dive right in. We've got this really interesting editorial from Dr. Praveen Ramachandra.
Oh, yeah, he's really a pioneer in this area.
He is, and I think he makes a really, really compelling case for why green endocrinology needs to be on our radar right now.
Yeah, and he starts by really highlighting the urgency of it all.
Yeah,
Like there are some serious threats to health out there,
right.
like endocrine-disrupting chemicals.
ADCs.
Yeah, EDCs. And then there's the whole thing about how climate change is putting stress on our hormones.
It's true. And, as endocrinologists, I think we're seeing these effects in our patients every day.
Oh, absolutely.
I mean, whether it's, changes in thyroid function or fertility issues or even, certain types of cancers.
Right. It all ties back.
It really does.
And what I like is that Dr. Ramachandra doesn't just point out the problem.
Right.
He offers a plan.
Yeah.
He's got these 4 core pillars of green endocrinology
Right.
that we can use to make our practice more sustainable.
Okay. I like it. Let's hear about these pillars.
Okay, so he talks about sustainable clinical practices,
Okay.
green pharmacology,
Interesting.
patient education,
Got it.
and then research priorities.
Ooh. I'm already intrigued. Tell me more.
Okay, well, let's start with the first one, sustainable clinical practices.
Okay.
I mean, think about simple changes we can make in our clinics to, lessen our impact.
Yeah.
So like Dr. Ramachandra says, we can invest in energy efficient devices.
Like what? Give me an example.
So LED lighting, swap out those old bulbs or like get a programmable thermostat.
Oh, okay.
And even, when you need to buy new equipment,
Yeah.
make sure it's Energy Star certified.
Oh, that makes sense.
Little things like that can make a difference.
But what about all the paperwork? It feels like healthcare runs on paper.
I know it's a lot, but we can actually go paperless.
Really?
Yeah, like switching to electronic health records, e-prescribing,
Yeah.
and even using telemedicine more.
Oh, wow.
It's more streamlined and it saves a ton of paper.
So we've covered sustainable practices in the clinic.
Mm.
What about this green pharmacology pillar?
Okay, so that's not just about prescribing eco-friendly vitamins or whatever.
Oh, yeah.
It's about looking at the entire life cycle of a medication.
Wow.
So, thinking about the environmental impact of producing it,
Uh-huh.
then how we prescribe it to reduce waste.
So like choosing meds with less packaging or opting for generics.
Exactly. And then making sure we dispose of them properly.
Oh, right. Because those leftover pills can end up in the water.
Yeah.
Right.
It's bad for the environment.
It's all connected. It's not just about our patients. It's about the whole ecosystem.
Exactly. And that actually leads us perfectly to the next pillar, patient education.
Okay.
As endocrinologists, I think we have a responsibility to educate our patients.
Right.
We need to help them understand the link between their endocrine health and the environment.
Yeah.
And encourage them to make choices that are good for both.
So like what kind of things?
Simple stuff, like reducing plastic use,
Okay.
choosing sustainable food options,
Right.
even just walking or biking more instead of driving.
So it's about giving them the knowledge and tools to make healthy choices for themselves and the planet.
Exactly. And not speaking of, but the 4th pillar is research priorities.
Okay.
This is where it gets really interesting.
Uh-huh.
Dr. Ramachandra wants more research into how climate change is affecting endocrine health.
That's huge.
Yeah, and how EDCs are affecting different hormonal systems.
Right.
And he wants to see more eco-friendly treatments being developed.
So like finding solutions that are good for people and the planet.
Exactly. The possibilities are, well, they're endless.
I mean, can you imagine like new diagnostic tools that use fewer resources?
Right. Or therapies that are effective but also have a low environmental impact.
This is really fascinating stuff. I'm really glad we're talking about this.
Me too.
Okay, this is all great in theory, but let's be realistic for a second.
Yeah.
As endocrinologists ourselves, I mean, can we really make these changes happen?
Yeah, I hear you. It can seem daunting, right? Like
Yeah.
even Dr. Ramachandra admits there are going to be challenges.
Yeah.
I mean, first off, there's the cost. Like think about buying all that new energy efficient equipment or switching to electronic systems. It adds up.
Yeah.
And, some people are always resistant to change.
Oh, totally. especially in healthcare, right?
Yeah. Exactly. People get used to doing things a certain way, and it's tough to break out of that.
I mean, it's human nature, isn't it?
Yeah.
But I like how you said earlier that challenges can also be opportunities.
Oh, absolutely. Like, think about it. Green endocrinology, it's a chance for us to collaborate more,
Yeah.
be innovative, and really become leaders in making healthcare more sustainable.
Uh-huh.
We can find ways to make these changes affordable. We can educate our colleagues about the benefits.
Right.
And we can advocate for policies that support a greener approach.
I like that. A win-win for our patients and the planet.
Oh.
Okay, but let's get real here. Has any of this actually worked? I mean, has anyone successfully implemented these green endocrinology ideas?
Oh, yeah, totally. I mean, Dr. Ramachandra actually mentioned some really interesting data and statistics in his editorial
Okay.
that show it's not just some pipe dream.
Give me some examples.
Okay, so for example, the National Health Service in England,
Uh-huh.
they've managed to cut their carbon emissions by 26% since 1990.
26%. That's incredible. How do they do that?
They really went all in, like upgrading their facilities to be more energy efficient,
Okay.
reducing waste. They have all these programs for that.
Yep.
And even encouraging their staff and patients to use more sustainable transportation.
Wow. It's really impressive that they were able to make such a big impact.
It shows what's possible when you commit to sustainability.
Okay, but that's a national system. What about individual healthcare systems? Are there any examples of them going green?
Definitely. There's this one that Dr. Ramachandra mentions, Stanford Healthcare in California.
Okay.
They've had amazing results with their telemedicine program.
Telemedicine.
Yeah. They actually avoided over 17,000 metric tons of greenhouse gas emissions in just 1 year.
Wait, 17,000 metric tons just from telemedicine? Seriously?
It's crazy, right?
Hmm.
And departments like psychiatry and cancer care saw even bigger reductions.
So it's not just about tweaking things in our own clinics. It's about changing how we deliver healthcare.
Exactly. And this is where Dr. Ramachandra's vision for the future really comes in.
Oh.
He has this really powerful call to action.
I'm all ears.
He lays out 4 main points.
Okay, let's hear them.
The first one is advocacy.
Mm-hmm.
We need to push for policies that support sustainable practices in healthcare,
Makes sense.
and that encourage research in this area.
We need the system to be on our side.
Right. Okay, the second point is collaboration.
Okay.
So, Dr. Ramachandra thinks we need to work with other experts.
Like who?
Well, environmental scientists, chemists, public health people, policymakers.
So a multidisciplinary approach.
Exactly, to really tackle these complex environmental health problems.
That sounds amazing.
Hmm.
Imagine what we could achieve if we all worked together.
Right. It's all about sharing knowledge and working towards the same goal.
Okay, what about the third point?
Education.
Got it.
Dr. Ramachandra thinks we should integrate sustainability principles into medical training
Right.
from the very beginning.
So that new endocrinologists are already thinking green from day one.
Exactly. And then the last point, it's leading by example.
Okay.
We need to walk the walk.
Put these principles into action in our own practices.
Right. We need to show our patients, our colleagues, everyone, that green endocrinology is real.
It's not just some abstract idea. It's a
Mm.
way to actually practice medicine.
Right. Exactly. Our actions speak louder than words.
So we've talked about all these big ideas, but what about you personally? How do you see green endocrinology playing out in your own practice?
Well, for me, it started with just being more mindful, like really thinking about the environmental impact of my choices,
Okay.
both at work and in my personal life.
It's about looking at the bigger picture.
Exactly. So, for example, I started making small changes in my clinic, like switching to reusable supplies, whenever I could. And I implemented a better recycling program.
Makes sense.
And I started talking to my staff about saving energy.
Small changes can make a big difference,
Absolutely. And I also started talking to my patients about environmental health.
like during their appointments.
Yeah. I'd explain the connection between their endocrine health and the environment.
Okay.
And I'd give them some tips on how to make more sustainable choices.
So you're empowering them to take charge of their own health and their impact on the planet.
That's the idea. And honestly, it's been amazing to see how much patients appreciate it.
It's about meeting them where they are and giving them the information they need to make good choices.
Exactly. But it's not just about what I do in my clinic.
Right.
I've also been involved in advocating for policy changes.
Like at your hospital.
Yeah, and with our regional medical society to try to promote more sustainable practices across the board.
You're really walking the walk. It's inspiring.
Well, I really believe this is the future of endocrinology, and it's a journey we're all on together. The important thing is just to start somewhere and keep learning as we go.
I like that. Progress, not perfection.
Hmm.
And, reading Dr. Ramachandra's editorial, it really struck me that he's redefining what it means to be an
In
endocrinologist.
what way?
It's not just about treating patients anymore. It's about being a steward of both human and planetary health.
Absolutely. That's such a powerful way to think about our role.
It takes us beyond just the clinical setting.
It challenges us to think about the bigger picture, how our decisions affect the environment.
Right. Like every prescription we write, every test we order, every lifestyle recommendation, it all has an impact.
Exactly. It's not just about treating thyroid disorders or diabetes. It's about creating a healthier planet for everyone.
Yeah, it's a big responsibility, but also an incredible opportunity.
And you know what? You don't have to figure all this out on your own.
Oh, yeah?
There are so many endocrinologists who are passionate about this stuff.
That's great to hear.
Like there's a whole community out there.
So we can connect and share ideas and, support each other.
Exactly. We're stronger together.
Yeah, that makes sense. And something else I was thinking about.
What's that?
As endocrinologists, we have a voice,
Yeah.
Like people listen to us.
We're experts.
We are. And we can use that to advocate for change,
Oh, absolutely.
both within our profession and, in the world at large.
Yeah, like we can raise awareness about how environmental health and endocrine health are connected.
Right. We can push for policies that support sustainability. We can be the change.
Totally. And it doesn't have to be anything huge.
Right.
Like you can speak at a conference or write an article for a medical journal
Yeah.
or even just talk to your colleagues and your patients about it.
Every little bit helps. This whole conversation has been a real eye-opener for me.
I'm glad.
It's made me realize that green endocrinology isn't just some fad. It's a real shift in how we think about healthcare.
Yeah, it's a big deal.
It's about understanding that human health and planetary health are connected. We can't separate them.
Exactly. They're intertwined.
They are. And it's an exciting time to be an endocrinologist,
It is.
We can be leaders in this movement. We can transform our practices.
And inspire the next generation.
Exactly. So
Yeah.
to everyone listening out there,
Yeah.
I encourage you to learn more about green endocrinology.
Read Dr. Ramachandra's editorial.
Yes, dive into the research.
Talk to other endocrinologists who are doing this work.
And remember, every step we take towards a greener practice is a step towards a healthier future for all of us.
That's a great point. And I think that's a perfect note to end on.
I agree.
Thank you so much for being here today. This has been such a great conversation.
It really has. Thanks for having me.
And to all our listeners, thank you for tuning in to The Deep Dive. We'll be back soon with another deep dive into the world of endocrinology. Until then, keep learning, keep questioning, and keep making a difference.